You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dow, and today is August 30th, and welcome to another episode of Last Week in Healthcare IT. As with every episode, we start off this one saying that the intended audience for this episode is everybody. So let's just get right into it. First news item, Apple Health Records signs with Allscripts EHR. Let's just start with a news topic that I was very surprised to hear. Pretty big news. Apple, if you don't already know, has its own health records app that all the iDevice users use to track their health. And the idea is that it's a personal health record that integrates all their health data from various sources into one. Just this past week, it was announced that Apple Health Records will be able to interchange data with Allscripts EHRs through the FHIR standard. This is a pretty significant deal because Allscripts is the fourth largest health system EHR vendor after Epic, Cerner, and CPSI. So having this deal is enabling Apple to almost be that one record for all your needs. So being able to have everything in one place is going to be potentially increasing patient engagement because now they can feel confident that they don't have to fumble around with so many different patient portals just to find out what their health status is. All right, so the next news item, data breach. So we're going to be talking about data breaches now. So data breach affects 10,000 people at Massachusetts General Hospital. So MGH, or Massachusetts General Hospital, reported that they had a data breach occurring in late August, meaning last week, in their neurology department that included patient private information of more than 10,000 people. That's a lot of people. This was a massive breach and included medical histories, their full names, date of births, and medical record numbers. Luckily, they said there were no social security numbers leaked, but still, that's still a lot of data that's being breached. So MGH stated that they are further taking steps to prevent future unauthorized access, and they're going to be using a third-party investigator to help review their data breach as well as contact law enforcement. So the next news headline, which I'm going to be saying it's very similar to what we just talked about, is statistics reveal that healthcare is still the most affected sector for data breaches. So the Information Commissioner's Office typically gets reported the number of data breaches that occur in the past year or so. So more than 60% of the personal breaches have been caused by human error, and the most affected sector turns out to be healthcare again. Between January and June of this year, 4,856 breaches were reported, and 18% of those breaches were from the healthcare sector. Other sectors that also had breaches were, government, education, justice, and financial services. And about half of all the data breaches were due to incorrect disclosure, which means things like, providing a patient someone else's patient information. So the next news item is NTT Data Services and Google Cloud team up to develop healthcare AI tools. So yeah, let's stop talking about data breaches and talk innovation. NTT Data is a Japanese system integration company that is known for providing technology-enabled services around the world. And Google is, it's Google. They are working together right now to create tools that help providers analyze and use massive amounts of data to provide better patient outcomes, and they also allow the payers to work directly with their plan members better. A lot of this will be based in value-based care, and there will be new infrastructures and applications built. And in addition, patient engagement and customer relationship management are some of the new focuses that they're going to have. And that should really bring it home with the patients and make them feel cared for. And finally, the last news item is AI-powered location services and Wi-Fi boost patient and visitor satisfaction. So let's end on, somewhat an obvious statement, but still a positive statement nonetheless. The VA in Orlando basically faced the issue of patients getting lost. They were getting lost because their facility was so large and hard to navigate through. So it sounds like a simple solution, but what they ended up doing was they increased their wireless access point coverage, and they also increased their location services capabilities. So this resulted in patients being a lot happier because now they are able to use a robust Wi-Fi connection with wayfinding services to find their way through the massive facilities. So before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's where I go for daily healthcare IT news to keep myself updated in what's going on in that world. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at PharmacyInformatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy ITME. And remember, technology is the tool, patient care is the goal.